Welcome back to Houston Life. October is Breast Cancer Awareness Month, and it's a reminder for all of us about the importance of early detection, which is why joining us today, we have Dr. Erin Bravo. Now, Dr. Bravo is a specialized radiologist with Solis Mammography. She's here to share important information about breast health, about screenings. Thank you so much, Dr. Bravo, for joining us on Houston Life today.
Yes, thank you so much for having me.
Okay, our pleasure, because this is the time of the year where it's top of mind, and Solis Mammography, this is something they do year-round. They're a leader in the breast health space. So I wanted to ask you, what trends are you really seeing in breast cancer rates right now?
Yes, that's a very good question, because unfortunately, we are seeing some alarming trends in breast cancer detection rates right now. In the last few years, we've seen a significant increase in breast cancer detection rates overall amongst all women. But even more alarming, we're seeing this increase in breast cancer detection in younger women, women less than 50. And it's almost double that of older women greater than 50 years old.
Oh, my goodness. So you're seeing breast cancer rates more in younger women, which is really something we've heard, get a check at 40, get a check at 40. That's when you start. But that's really not the case anymore, is it?
Correct. So that's what we at Solis Mammography really want to help educate patients. We want them to know about these increase in rates of breast cancer, especially in younger women. And we want women to be empowered to make a decision that's best for them. So the current guidelines are that every woman at average risk should have a screening mammogram beginning at the age of 40 and every year after that. But with this alarming increase in breast cancer detection rates, especially in younger women, we want women to consider having a baseline mammogram between the ages of 35 and 39 years old.
Okay, for those of us who maybe don't know, what exactly is a baseline mammogram, and then why is it important to start considering it before you turn the age of 40?
Great question. So a baseline mammogram is your first mammogram, and this mammogram gives us so much information about your breast health at the initial exam. So we use this mammogram. We often, sometimes unfortunately, we do find abnormalities on that first mammogram, that baseline mammogram, that do require further evaluation and even a biopsy. But also, this baseline mammogram really serves as a guide for us going forward to help us read future mammograms. We're always looking for those really subtle changes on the future mammograms compared to the baseline mammogram.
Okay, so that's a really good reminder. I mean, and so the baseline is really the first one. And then why is it critical? Because I feel like life kind of gets in the way. We're all very busy. I know there are working moms, there are all kinds of moms. Why is it so important not to put off that mammogram?
Yeah. Like I said, we're finding breast cancers younger and younger, unfortunately, and really taking the time out of your day to get that baseline mammogram, to get your yearly mammogram is just very important, because our goal with screening mammography is to find breast cancers as early as humanly possible. This really affects treatment going forward if a breast cancer is diagnosed, and the overall curability of if you are diagnosed with the breast cancer.
Yeah, so that detection, the quicker it happens, the quicker that you can get a plan in to make sure that you're healthy for your loved ones here. Is there anything else that we should know about Solis Mammography?
Yes, absolutely. Like I said, this is what we do all day, every day. So for us, we understand that's a nerve-wracking day for patients. We do our best to make it as enjoyable as possible, because it is so important. Having that yearly mammogram is so important to your overall breast health.
Well, Dr. Bravo, I want to say thank you so much, because this is important information, and it's something that we should not put off. That annual mammogram is so important. Just to remind our viewers, Solis Mammography has more than 20 locations right here in Greater Houston. If you'd like to find a location near you, visit solismammo.com, or you can give them a call, 833-510-9397.